Are you and Tom in the same program, Thomas?
No. So I study
Oh,
European law.
okay.
Yeah. So slightly different. But we are here to talk about you. And this is the one thing I am not. Oh, yep. There is
Are
a
you
slight
and
delay.
Tom in the same program, Thomas?
That should be muted. Right. So we are now live, and it's great to have you here, Viktor. Maybe you want to start talking through just what you do with your research and what it's been about so far.
Sure. So yeah, thank you for having me. Um, so I'm actually a rising second year doctoral student in the social behavioral science program at Virginia Commonwealth University, which is in Richmond. So coming from the US. um, and I'm predominantly looking at how to utilize innovative and at-home technologies to prevent um, prevent, to detect, and then maintain HIV, along with other chronic illnesses. But HIV is really my specialty right now. And then just kind of making this bigger, broader claim to this mind and body connection.
So that's a very interesting topic that you've got there. Maybe you want to talk about how you got into it to start with?
Yeah. So I have my bachelor's in psychology and sociology. So I originally came to the university only studying psychology, and I was looking at different things and thinking there's aspects that are missing. There's people's stories, there's narratives, there's community stories that are missing. So I really started looking for some of those answers, which is how I unraveled sociology and really fell in love with that field. And as a merger to some of my early on kind of work development pieces, I started looking more at how do we merge these two fields together. So how do we merge the fields of sociology and community with individual pieces? And later on in my career, I started getting really interested in somatic symptoms. So people who were showing kind of these ways that depression really affect you in a physical way or anxiety really affected you in a physical way. And so when I came to apply to my program, I saw kind of these integrations of public health and other pieces that just really navigated this way for a really clear way of how to integrate kind of all of my background and my early kind of development.
That's a really interesting journey and a nice way into the field. So you started to introduce your research. Maybe for our listeners at home, you could kind of talk through what home care there is for HIV and what you are looking at more specifically in terms of how to provide it and
Yeah.
various.
Sure. So there's a couple of different layers to the HIV spectrum, and one of the first is obviously prevention. So there's a lot of ways that we can prevent HIV, whether that's condom usage, whether that's a pre-exposure prophylaxis, PrEP, as it's commonly called, which is a pill you take once a day to prevent HIV. And all of those things can be really done at home and monitored at home by individuals. Um, and then the second step, if you were to contract HIV or you were to have a concern that maybe you contracted HIV, that's where we have a lot more technology starting to develop in detection. So we have at-home kits that you can easily take a finger prick or a swab, and they can do at-home kits where you can send those into a lab, and they'll have your results either in a lab or they'll show up right at your house, depending on which kit you get. Um, and so that's a really quick way to determine, do I have this? Or if there is concern, you can go to a local clinic or a local emergency room, and they have a post-exposure prophylaxis which you can take. So there's a little bit of a that's not necessarily in the home yet, the PEP, but the at-home kit for detection is. So that's really helpful to kind of have some discreetness and privacy when you're detecting, because I know that that's a big concern and a big stigma in getting tested in general. So that's a really great technology that that is available. And now we're starting to look at some other things as far as like maintenance. And so there's been a big segue to how do we get people to maintain their undetectable status once they reach that, or getting to the point where they're taking their medication. How do we get them to this point? And so there's a lot of different ways to do that. So there's pill tracking where you can see how often people are actually taking their pills. Um, there's there's reminders on your phone for different apps. There's apps that connect you to different providers. So there's so many facets of the maintenance phase that are starting to develop, and we're starting to really gear up on that because the CDC and the World Health Organization declared undetectable as a status that means you can't transmit HIV anymore. So having people reach that more often is a really big prevention technique too. So it kind of comes full circle where if we can help people who are HIV positive become undetectable, we go back to the phase of prevention too. So um, my research really focuses on the maintenance stage because I really want to figure out in the communities, are at-home technologies, are at-home innovations accessible? Are they affordable? And are they useful in getting people to an undetectable status faster and maintaining that undetectable status long term?
Okay, so that's an interesting and obviously very important area of research. So maybe you'd like to expand on how you are looking at this maintenance phase.
Yeah. So the first step of a maintenance phase is obviously to get people knowing their status and then getting them connected to providers. So I'm really working in this community development aspect. So in our program, we learn about community-based participatory research, and community-based anything is really vital, I think, to anybody who is looking at doing something that's going to have a lasting impact, so sustainable impact. So for me, that's really looking at how can I cast a broad net on who's involved in the HIV care and HIV spectrum. So when I'm looking at that, I'm looking at not only health providers, but also like bars that maybe people frequent that could give attention to getting tested, um, or pharmacies and that connection. So just all of these different resources in the community that can really help get people to detection, and then we can start working on that maintenance piece. So once people are in the detection phase and then go into actually the phase where they find out that they have HIV, that's where I pick up and I kind of look at what are the challenges and what are the supports available in people's lives that can really empower or disempower somebody from taking their pill on a daily basis. And that could be anything from I don't have transportation to get to the clinic. I don't have the money that affords me the medication I'm on. I don't have healthcare insurance. I'm afraid of the medication. I'm afraid of the symptoms. So there's a whole spectrum of what could be a barrier to getting somebody to take their medication. But then we also have to look at the support. So are there family and friends around who really want people to be on their medication so that they're healthy? Are there people in the community who can talk to them and let them know that what are the fallacies out there about the side effects and the lasting implications of being on the medication? And can we work with other providers to really make medications accessible, whether that's mailing medications to people, having reminders? So that's where I'm at, is on that side of figuring out what are all of these different systems available? How do we get all these systems to sit at a table and connect? And how do we make that as easy as possible for an individual to make them make a decision that's going to help themselves and help community members?
Yeah, and that is obviously a very important aspect, the community impact and how you link it all together. But as you kind of voiced a bit earlier, there is a stigma around HIV. How do you think, or what problems will it pose in terms of being able to have that community impact while there is the stigma and maybe people are afraid of getting tested or afraid of the treatment? And how will you work to tackle that almost?
Yeah, that's a really good question. It's really hard because Part of it is just education. So stigma and destigmatizing anything is so challenging because there's a lot of layers to a stigma. I think that the HIV stigma goes back to stigma surrounding the gay community in general, being a sexual minority, that there's also racial implications associated with HIV. So there's a lot of like hot button topics that are kind of wrapped around the stigma of HIV. Um, I think part of that is community education. So I think that there's a community inside of being HIV positive. There's people who may know each other. There's people who may be HIV positive and live outside of a community. The community I focus on mainly is the men who have sex with men, and that's a very broad community because in that you may have out and loud and open gay or bisexual or pansexual men. In that you might also have very discreet, not out, do not identify with the queer community who might have sex with men. And so casting such a large net on my community means that I have to be really careful and really insightful and really open to the fact that you're going to have different levels of stigma in there. So an out and loud gay man might have a very different interaction with stigma than somebody who's very discreet and nobody in his social network knows anything about him having sex with men or about his HIV status. So I think part of it is navigating that that you're going to have different levels of stigma associated with the community, and you're also going to have to figure out what is the most salient piece of that stigma for that individual. And in every community, in the larger community, so in every city, there's going to be different interactions with HIV. In every country, there's going to be different interactions with HIV. So you have to kind of figure out what are the most salient pieces of the stigma and where what is strategic to address. So whether that's education, whether that's more representation of people who are healthy and successful and doing well and still having HIV, whether that's more podcasts or more activities surrounding the HIV community to let people know that these are community members. They're people of the world, and they're accessible, and they're not lepers. Like they're not lepers that maybe people in the 80s kind of associated HIV with because it was progressing so quickly to AIDS. That there's such a difference between the 80s and 30 years later, 40 years later, where we're doing really well kind of addressing and getting people to have longer lives and live really healthy, normal lives with HIV.
Yeah, okay. And so you've got, but I think 3 years left on your program, did you say?
Yes. Mm-hmm.
And what do you think those next 3 years will hold for you in terms of where the research will go?
Yeah, so right now I'm working on kind of the beginning foundational pieces for my dissertation. So I'm working on two scoping reviews, which are just kind of these large, casting my net large for looking at all of the literature associated with at-home technologies and innovations for people who are HIV positive, or also just men who have sex with men, because I kind of want to look at both sides of it, whether they have HIV or not, to see like how are people using technologies in the community that I'm interested in. And I just want to know what that means and how effective that's been, and just casting a large net in one direction. And then I'm also really interested in certain methods. So I'm casting a couple nets in different methodologies that have been either effective or ineffective in doing research within the community, and figuring out all of that before I go into like even really narrowing on my question, because the larger net I cast, the more tools I have to kind of say, here's what we do know that's effective, here's what we do know that's ineffective, and here's how I can address a question that's going to have real implications and going to be sustainable and cost effective for the community and the community members. So I think over the next 2 or 3 years, after this year, I think will be when we apply for grants in the spring. So this next spring, I'll be applying for grants for my dissertation funding, and that's where I'm going to really narrow down like where do I see funders who are going to be interested in the research that I'm doing, and figuring out what funders are looking for, as well as how I think the funder really also determines where this is going to be applied and how they want that to be applied. So I want to find a funder. I want to find a grant source that's in line with that and in line with a lot of the mission of kind of what I'm trying to address, and that will kind of drive my next few years.
Yeah, that's really interesting. And obviously, this project is several years long, but at some point it will end. And
Yes.
what do you see for yourself after that?
Yeah, so I definitely see myself going into industry after I graduate. I love academia, and I think academia is really valuable. But I want to have some some actual experience under my belt, and not that I don't have work experience prior to, but I really want to see how I can take some of the research that I've done and apply it and see how to develop a lot of these sustainable um, pieces of that. And ultimately, I see myself working maybe alongside of some of the insurance companies that can help really expedite at-home technologies, and maybe link into that to see if we can develop more technologies that are going to be helpful for maintenance and cost effective long term, and can be incentives for people to stay healthier.
And that obviously has a large social impact as well. Um, Now, you spoke really early on, and I'm now jumping quite a far way back, about psyche and its relationship with everything. And maybe you want to elaborate on that a bit.
Yeah, yeah. I think I talk a lot more now about medicine and health than I did when I first came into the program. But I think that psyche is part of all of it. I think that um, your emotions and your past and kind of what you're feeling really determines and really dictates how likely you are to engage in anything. So if you think about the most excited you've ever been or the happiest you've ever been, there's heightened motivation there. There's you want to do something, you want to kind of conquer the world. And I think everybody has a moment in their life, or hopefully everybody has a moment in their life where they feel that adrenaline, that motivation to do something, um, and and that really determines whether I'm going to get connected to medication, whether I'm going to get connected to a doctor, whether I even care to be connected. So I think your emotions definitely dictate a lot of these interactions and a lot of the ways that you feel about your own body, you feel about your own worth, and then ultimately how you decide to progress or to avoid um, kind of getting involved in interventions. Um, so I think that there's ways to intervene directly on the psyche. So whether that's a therapeutic intervention, whether that's therapeutic medications, psychotropic medications, there's ways to intervene on the psyche directly. But there's also ways to address the psyche along the way of addressing health. And I think that that's the middle ground I'm trying to find now is figuring out what is the catalyst. Is the catalyst addressing the psyche first, so that way people are more motivated to go into this spectrum of HIV care, or is it helping empower them along the way of this HIV spectrum, and hopefully that improves the psyche. So um, I think that there's two ways to go about it, and both are really important, and both are going to be essential. But finding the catalyst within the community is a job in of itself, and that's kind of what I'm aiming to explore too, is which is going to be the catalyst.
And you said that you want to go into industry and look at how, sorry, I'm now jumping back again, but how you want to explore how it can be delivered through like insurance and other community parties. Do you think that you want to stay within looking at HIV, or do you think you want to expand into other infections and diseases? And do you think it will be very much focused on men whom have sex with men, or do you see yourself branching out into other affected groups and into more diseases. Sorry, I was looking for a word and I couldn't find it.
I see myself starting out in HIV because it's something I know. It's something that I've studied kind of throughout my my university education, but I don't see it as an end line. I see it as a baseline. I think that HIV has so many steps involved in it, so that makes it a great focus right now because I can see implications along this spectrum that other diseases do or do not have. But if a disease kind of starts out very complicated, or a virus starts out very complicated like HIV, that if I jump to something a little bit more simpler down the road, I can kind of show that I've done something a little bit more complex earlier in my career, so that jump isn't as obscure. That these that maybe I know that there's a lot of technology out there for diabetes, for example, and at-home testing for diabetes, and at-home maintenance for diabetes. There's starting to be some things for hypertension, and so those are all appeal to me too. And those are things that I'm kind of keeping my eye open to see are there other diseases that may impact the men who have sex with men community, and are there other diseases that may not affect this community but are developing in at-home technologies. And so having kind of an understanding of both allows me to say, down the road, do I want to stay in this community and just look at other diseases within this community? Or do I know enough about at-home technologies because of this community and I can apply that to other diseases? So I like to be flexible. I definitely like to be available and accessible to both sides, or to multiple things, because I think that that's how you figure out what is going to be most impactful for that time.
Yeah, that's a very interesting point, so thank you. I'm aware we're coming towards the end of our half hour, so maybe just if you could briefly summarize what takeaways you've had from obviously the literature so far and the research you've conducted.
Yeah, so there's a lot of great things happening in HIV care, and that's really exciting. And I think that the more we can help in our daily conversations to break that stigma, the more we're going to help people get onto that spectrum. So we're going to help people in the way of prevention. We're going to help people get tested more often. And we're going to help people who may have an HIV diagnosis get the treatment that is going to really make their life better and make prevention a lot more accessible. And so I think that that's a big takeaway, is just the conversations we have, the way that we talk about HIV, and the way that we address it. The more language that we use that's empowering and less stigmatizing, the more chance we have to make a really big and sustainable impact.
Well, thank you very much for joining. It was great to hear from you.